This is Selma Schimmel for the group room at the San Antonio Breast Cancer Symposium. Joining me now, Dr. Richard Finn, Associate Professor of Medicine at the Jonsson Comprehensive Cancer Center at UCLA. It's nice to see you again. Last time we worked together, you were on radio with us.
Yes, thank you very much. And we were discussing the early part of the study that was presented yesterday at the San Antonio meeting.
We're going to be talking about news on the front for advanced estrogen receptor positive breast cancer.
So ER-positive breast cancer is the most common subtype of breast cancer. Certainly there's been improvements in the management of that disease with the impact of hormonal agents and even in the past year or so the addition of everolimus for patients who have hormone refractory disease. But the study that we presented yesterday was a study looking at a novel investigational agent, PD-0332991 or PD-991, in combination with letrozole versus letrozole alone for the frontline treatment of metastatic ER-positive postmenopausal breast cancer. The study was exciting because of the results that we delivered in regards to the improvement in progression-free survival. The study is also very interesting because it actually grew out of a rational way to develop a drug in breast cancer, that is a scientific program using lab models that identified a specific subgroup of breast cancer that seemed to be dependent on this novel target.
Is it an IV or is it oral?
PD-991 is an oral agent. It's a very selective inhibitor of a novel target, cyclin-dependent kinases 4 and 6. Cyclin-dependent kinases 4 and 6 are a new target in cancer medicine. They're involved in cell cycle progression. And the idea behind pursuing this target in breast cancer is that by blocking it, we would be able to block progression of tumor cells.
When it's given in combination with letrozole, that's oral as well.
Correct.
So this, again, is representative of the new wave of treatment. This is all oral compounds.
For sure. Not only is it all oral, but it's all very well tolerated.
Side effects?
Side effects are very manageable. We did see some leukopenia. The most common side effect was low white blood cell count as well as neutropenia. However, it was very manageable. It was not the leukopenia, neutropenia that we see with chemotherapy in that it was uncomplicated. There was no incidence of neutropenic fever. It was self-limited and could be very easily managed with dose adjustments.
How long does one stay, or so far have your patients been on the combination therapy?
So we are looking at a population of patients that have incurable breast cancer. It's in the frontline setting, so we know the natural history of this disease can be several years because there are active agents, but still there's a large unmet need for new drugs for this group of women. The study results that we presented yesterday show a pretty dramatic and what I would say unprecedented improvement in progression-free survival. From the women who received letrozole alone, about 7.5 months was their progression-free survival. And with the addition of PD-991, that progression-free survival was increased to over 26 months. So that is really, I think, groundbreaking.
Significant.
Yeah.
What happens now?
Well, now we want to proceed with a definitive study that would provide us to get the drug approved, essentially a phase 3 study. And the goal is to start that study next year.
What do you foresee as the phase 3 component of the study?
So in the phase 3 component, we hope to recapitulate the results we saw in the phase 2 study. To that end, we will accrue a similar population. That'll be frontline, ER-positive postmenopausal breast cancer, randomizing them to letrozole alone as standard of care versus letrozole plus PD-991.
Thank you, Dr. Richard Finn, Associate Professor of Medicine at the Jonsson Comprehensive Cancer Center at UCLA in Southern California.